Yeah, so I think in lower risk MDS, we're really predominantly treating the symptomatic cytopenia. And so the vast majority of patients who are symptomatic are anemia patients that often require transfusions. So I think exciting, we're anticipating approval by July of Imetelstat, which is a first-in-class telomerase inhibitor, had a positive review at ODEC, so we do really anticipate that approval. I think what's exciting about that patient group when they respond is that the magnitude of hemoglobin improvement is quite impressive. It's over 3 grams per deciliter, and that's actually quite impressive versus, let's say, other agents. So I think it's going to be another agent in our armamentarium of treating transfusion-dependent anemia patients. Again, we have luspatercept, imetelstat, ESAs. I think, one of the big paradigms is really trying to push off HMA-based therapy as far back as possible because it has not changed the natural history of these patients. There are response rates, but there are also more cytopenia toxicities and more issues when patients fail that they kind of behave higher risk. That being said, there are roles for there, and again, we're trying to move, we have oral decitabine, but there is a new PK equivalent oral azacitidine that is going to be working towards us approval as well. There's also some updated data at this ASCO conference by Dr. Garcia Monero with the currently approved oral azacitidine at a little bit of a reduced schedule. So again, we have those agents, but we're really trying to move those later in line. I think maybe what's more exciting is trying to target some of the underlying pathogenic mechanisms, and there are some novel studies looking at inflammasome inhibitors that have really just entered study, and hopefully we'll have data over this upcoming year.